Hi, everybody, and welcome to DocTalk. I'm Dr. Erin Knopf.
Dr. Corinne Hannan.
We are so excited to have an incredible guest today joining us. Rowen, you are a peer recovery coach for Transcendence Recovery here in Colorado. Tell us first, before we dive into our conversation today about substance use and eating disorders and the parallels overlap, what does it mean to be a peer recovery coach if someone's never heard the term before?
A peer recovery coach is someone with lived experience. So it is a requirement that we are in recovery ourselves, but it doesn't, really matter what we're in recovery for necessarily.
I know it's one of those things where it's like, yes, I'm taking my lived experience and expertise to really this beneficial purpose, right? I now feel a calling to be a part of someone else's journey because probably someone did that for you, right?
I actually did not. Coaching is pretty new, actually. It's something that's really only popped up in, I'd say, the last like 5-ish years or so. And it's only in the last 1 to 2 years become a lot more popular as far as like one of the resources that people are really harnessing in on and taking advantage of when it comes to recovery. Biggest thing that I tell my clients is that I'm just here to support. Am I here to teach you coping skills or basic life skills or things like that? Yes, of course. But I'm ultimately here to support what you believe is best for your recovery. And so I will guide you. I will hold you accountable. I will have those hard conversations when I feel like you might be slipping, but I'm not going to tell you what you should do.
Yeah, because at the end of the day, that would be following the same pattern of these disorders. They give lots of shoulds all the time. Should. And that's why we say don't should on yourself. Quite literally. Yeah, I love that. You're holding compassionate boundaries with your clients, it sounds like. Okay, so then tell us a little bit. You don't have to go into too much, but tell us a little bit about your own journey and how you got to this point.
So I am in recovery myself, both for substance use and eating disorders. I was diagnosed with atypical anorexia when I was about 20 years old, but I've been in the mental health and psych field since 2021 when I started my forensic psychology degree. And I've been working in the recovery field a little over 4 years. I've worked as a behavioral health technician, as a clinical assistant, and now I've been a coach for going on a year soon, actually.
Very cool. Thank you for your work. So
Thank
we
you.
were talking about some of the overlaps between eating disorders and addiction. And one of the things that came up really quickly was control, competition, comparison, trying to avoid and avoiding negative feelings. Anything else you want to add to that or expand on with that list of overlap?
Yeah, I mean, there's a lot of parallels when it comes to eating disorders and substance use. A lot of them are, or like a lot of the reasonings are rooted either in untreated mental health, and like you were saying, control or avoidance are two of the biggest things that we see in substance use recovery. But eating disorders are going to affect someone very similar to the way that substance use does. The life kind of breaks down, health breaks down. There's financial issues, familial issues, you're breaking bonds, or people have to step away completely and put up a new boundary there. So there's just so many parallels. I tell people that they're like cousins. They're related, but they're not in like the full same family.
Totally. Yeah, I also like the distinction too. As an umbrella, we use these fancy terms in eating disorder care of maladaptive coping strategies, meaning there's something intolerable, whether it's a lack of control or big feelings or feelings you want to suppress and repress. And you get into this pattern of behavior that feels good initially, feels like it's working, feels like it's doing the trick, but ultimately it is so harmful. It is not actually adaptive, it is maladaptive. Yeah, I think we see behavior swapping so often for individuals. When they try to reduce one behavior, they end up filling it in with another one because the brain just has its reward pathway completely hijacked. But I think this brings up a good point of, is food addictive? And with that, Dr. Hannan, I actually want you to answer this one.
Yeah, so just with your maladaptive coping strategies, the way I like to talk about that is that it always has a short-term gain with a long-term backfire. It might work in the short term to manage your difficult emotions, but in the long term, it just really backfires and screws everything up. And there's always going to be like this obstacle that you have to come and decide what you're going to do with. even though it may have worked in the short term for you. And no shade, like depending on how young you are or how distressed you are, you're grabbing at whatever tool is available to you. And maybe it's a hammer. And for a minute, a hammer works. But then after a while, a hammer, if that's all you're using, it's going to start destroying your life, right? But back to your original tee-off question, I really like to differentiate for people that you can't be addicted to food. And I know that there's a lot of chatter about that, about food is addictive, but this is my take on it, and I stand by it. Okay, that you can't be addicted to something that is necessary for your survival. Like you can't be addicted to oxygen, you can't be addicted to water. You can't be addicted to food because they are necessary for your survival. You can't ever cut them off or you'll die. And you can cut off substances and you won't die, hopefully. But you can be addicted to manipulating food. You can be addicted to trying to manipulate your body or the way that you move your body. So the process with addiction, the way I talk to my clients about it, it can feel very similar to addiction. In fact, one of the metaphors I use is like dieting is like smoking, and like the people around you are smoking. And the more that people around you are smoking, the more likely you're going to want to smoke, because it starts, you start craving manipulating your food or manipulating your body. So that's how I talk about addiction with food, that it's not food that's addictive, but it's the manipulation of it that can be addictive. Rowen, how do you feel about that? And then how do you talk to people about addiction to substances?
I definitely agree. At least for me, and my journey, it was definitely the behaviors that became more of that routine and that like addiction piece, rather than like food itself, because for a long time my view on food was actually I don't want that. So it wasn't that like craving of, oh, I gotta have all of this food. It was the behaviors itself. For me, it was definitely rooted in control. I didn't feel like I had a lot of control over my life, and so I controlled the one thing that I knew I could, unfortunately. But when it comes to describing things from a substance use standpoint, I think a lot of it does kind of parallel with what you said. It's the behaviors ultimately, because they've done studies and they've proven that at some point, a lot of individuals who have an addiction in general will come to a point where they're like, I don't want to do this anymore, but they're seeing themselves almost like as a third person doing that behavior anyway. And so there's this fight in the brain between the want of the behavior and the actual act of doing it that becomes disconnected at some point. And that's usually when someone kind of seeks that help and is like, hey, I need to get better.
Let's also talk about how shame and secrecy overlap with substance abuse and eating disorders. Do you want to start us off with that, Rowen?
Yeah, sure. There's definitely a lot of self-forgiveness that's needed, especially in early recovery for substance use, but also eating disorders. And it's about 35% of individuals that are in recovery for substance use also have an eating disorder. So there is that overlap there a lot. Often it does take a lot for someone to start overcoming that shame and that guilt, because when someone's in substance use, they've often spent months, years hiding things from their family, from their loved ones. If somebody calls it out, then they deny it. So then when they do get sober, when they start to find recovery, they could then view themselves as, I don't want to be a liar, I don't want to be looked at as somebody who's manipulative. And so they have to kind of go through that cognitive process of like forgiving themselves, forgiving their behaviors, and then also asking outside people often for forgiveness as well. So there's a lot of shame
And
and
I
guilt
think
that comes with that.
I think it's so clear when you say it that way, that shame and guilt is the engine for keeping you in your disease or in your disorder, because it is interfering with authenticity and connection. And ultimately, that's why it has to be let out. It has to be in the space with you, with others, in order to go away, right? Dr. Hannan, you were saying that there is a difference, right, between secrecy and privacy. Even though my kids would say, no, it's the same. I want privacy. Leave me alone, blah, blah, blah. I'm curious, can you make that distinction a little bit?
Well, I was just going to say too about how eating disorders we've talked about in previous doc talks are really selfish illnesses, and they want to just stay alive, and they don't necessarily care what they have to do or what they have to say to you to get you to engage in the disorder to keep the disorder around. Now, I would argue that that's very similar to an addictive process that's selfish in the sense that it wants to stay engaged. The addiction wants you to continue to engage in the behaviors. Another thing that feeds that selfishness is secrecy. Eating disorders thrive in secrecy, so do addictions. And secrecy tends to breed shame. When we're alone with something, when we're hiding something, we tend to feel shame. And it gets really tricky because I do believe that all people have a right to privacy. And I think that's why for decades, therapy felt kind of tricky to talk about for people because it's private. And that doesn't mean it's shameful. So luckily, I feel like the current environment is that therapy is not shameful anymore, even though it is private. And that one of the really cool ways that people start recovering from addiction or recovering from eating disorders is opening up about it. Rowen, you said really beautifully, the opposite of addiction is connection. And I would just add non-judgmental connection. I've run so many eating disorder groups, and just seeing people like open up and tell people for the first time in their lives, their real story about some of their real lows, some of like the most embarrassing things that have happened to them with their eating disorder, and I'm assuming with addiction as well. That's why a lot of these programs are so helpful, because they just finally don't feel alone. So privacy, we love privacy, and I feel like these addiction programs are private, but like being solitary and secretive tends to breed shame. Anything you want to add to that, Rowen, or correct about what I said?
Yeah, I mean, especially in early recovery, creating some kind of community around yourself is really important. And that's why we tell people find a program. It doesn't have to be AA if AA is not something that you vibe with. It can be Recovery Dharma, it can be Smart Recovery, it can be Sober Faction, something that allows you to connect with the people around you in a non-judgmental space. So that you can be vulnerable and start to process some of that shame and guilt that does come along with it.
I mean, Brene Brown names that the root of courage is actually vulnerability. We have it somehow twisted of I can't be seen as weak, but being vulnerable isn't actually a weakness. It is a strength, because you are asking the universe, other people that you find worthy, to be aware of something that's hard and difficult to manage for you.
To see you, like literally actually see you.
Actually see you. And it's so interesting how, again, we are wired, or at least modeled, to hold this all in. Like, don't let anyone see, don't let anyone see. Let me like hold it to myself. But again, that is what keeps you stuck to it versus letting it go.
Yeah, and what I would add to that is that I always like to warn people that vulnerability never gets easy. The definition of vulnerability is that it's difficult to do, but your willingness to do it can really improve with practice. And like Dr. Knopf said, it is not weak to be vulnerable. It's actually very, very brave. And it requires a lot of courage, a lot of effort, a lot of energy, and a lot of strength to be vulnerable. Vulnerability is a superpower that is not easy. It's never easy. If it's easy, you're not being vulnerable. That's kind of the bad news. But the good news is it gets easier to be willing to step into the space, especially like Rowen was saying, if you're with a group of non-judgmental people who share part of your journey and really want to encourage you on that journey. I've worked with people individually and in group, and some of the powerful recovery that I've seen happen in group could not have happened in any other place except for group. So having a community, like Rowen was saying, can be a complete game changer with recovery of all sorts.
Makes sense. You had said opening up about what is shameful is actually incredibly healing. And I think it is through that learned experience, lived experience, experiential evidence, whatever words you want to use, that you can surprise yourself in doing something hard, and that it can feel gratifying to do something hard. And having that be part of your memory now makes it more likely for that pattern of behavior to continue. So you can start seeing yourself through a new lens with new capacity, perhaps. Yeah, that's probably the root of it all.
One thing that Rowen was talking about really beautifully in our just little preparation session was how with addiction, you can start with wherever anyone is at. And the same is true no matter what your behaviors are, no matter, some people get very ashamed with their eating disorders, like, how do I not know how to eat? This is very embarrassing. I'm X years old and I don't know how to feed myself. I don't know how to eat normally. I need help. And, as eating disorder experts, we try to just really diminish that shame and be like, it doesn't matter. We can meet you exactly where you're at and work from there. And everyone has access to this. Can you tell us what you were saying similarly about people with addiction and where they might have some functional difficulties that you need to meet them there?
I make a concerted effort to remind people that one of the things that they want to stay away from as much as possible is comparing themselves to the people around them. It's one of the most detrimental things to someone's recovery, no matter what they're in recovery for. Because the moment that they're like, oh, this person is so much farther along in their recovery than I am, or they know so much more than I do, is the moment that they lose that motivation, they lose that confidence, that drive to be better starts to wane. And if someone needs to relearn basic life skills, like how to clean or hygiene, if someone doesn't know about like skincare routine or self-care nightly routine to be able to calmly get into bed and get a good night's sleep, then that's where they start. And that's where we meet them. There's no judgment there because everyone does start in whatever capacity that they are. They've done studies, and through those studies found that people, when they move into recovery, they are entering recovery in that same cognitive mindset of the age that they were when they started using. So if someone starts using some types of substance at 12, then and they use that until they're 27, they're entering 27 in recovery with a lot of life skills that a 12-year-old still has. So they're coming into recovery with that mindset of a 12-year-old, with the skill sets of a 12-year-old. So that person often has to learn about effective communication and healthy boundaries. Oftentimes people don't have any boundaries when they come into recovery, or what a healthy relationship looks like, or how to build a resume. So it doesn't really matter where someone starts. We're going to meet them where they are, but they have to remember not to compare themselves to the people around them.
It was so interesting. The parallel, of comparison being the thief of joy for anybody, by the way, anybody, but definitely in these populations is so obvious. But what's interesting, and I was kind of just tripping on this in my head, was the fact that in substance treatment, it sounds like people are comparing about not being far enough along their recovery journey. But in eating disorder care world, the patients are comparing to each other about who's sick enough, kind of being back in the eating disorder itself. People are always undermining and minimizing their need for care through the comparison of I'm not sick enough to have all of this, concern about me. I don't hear a lot of my patients saying, oh, I'm just not as far along in my recovery as so and so in the milieu. You don't hear that.
Yeah, maybe a distinction I would offer is that it's competition. And,
Mm.
and the comparison can be motivating. It often isn't, but our brains are wired. That's how we are social learning creatures, as we can watch someone else's behavior and learn from it. That's the comparison thing. But the competition thing, like with eating disorders, they want to be the sickest in the room. That's not helpful. It's very, very sick. And it sounds like with addiction recovery, well, they're so far ahead of me. I can't even get started. It's really paralyzing and demoralizing. And so we say in eating disorder recovery, eyes on your own plate. I wonder if like in addiction, it's just like eyes on your own process, eyes on your own function, eyes on your own situation, because sometimes if you see someone ahead of yourself, at least with eating disorder recovery, that can be really motivating to my clients. Like, oh, I have hope. Like maybe one day I can eat 3 meals and 3 snacks a day without having a meltdown. Like so-and-so did, and they used to be as sick as I was. And, but the competition piece can really muddy the waters, kind of how I would clarify.
Yeah, something that we say is keep your side of the street clean or stay in the middle of the boat, because really all we can do is control what we're doing and what we want for ourselves. And that is something that a lot of people struggle with in early recovery because they're not used to that. They want that control. They want to harness it and like sometimes chokehold it. And so we have to remind them, stay on your side of the street. Don't worry about what other people are doing. Focus on what you are doing. Focus on your goals, on your path of what you're wanting for yourself, what life you want to build, because ultimately that is what they're doing in recovery. They're building a whole new life. They have to figure out how to navigate life without substances now. They have to figure out how to find the life that aligns with their values and their goals that they want for themselves.
Get
I think that's
emotion without substances, right? That's great.
And I think that's actually a wonderful segue into something you said was your favorite thing to dispel for people, the myth that you cannot have a productive life after getting over a drug addiction, substance addiction when you're in recovery. So, can you say more about that experience and the inspiration you see every day?
Yeah, I encounter this a lot because it's a stigma that gets put on people so much that even people moving into recovery have it for themselves. You know, kind of like you were saying earlier, how people will say like, "Oh, I'm not sick enough." We do sometimes see that in in the substance use recovery where people are like, "I'm not as bad as that person though, so I don't need these classes or things like that." But the moment that someone starts buying into that stigma of I can't have a productive life, I can't have a good family, good house, you know, good job, things like that. I have seen so many people turn their lives completely around just because they harness in on the program that they have and they really just put their feet on the ground and go with it. I've seen people go from literally having nothing when they come out of treatment to having a family and getting married and, you know, buying a house. I- Inspiring, honestly. And, you know, I tell my clients all the time that the people in recovery are some of the most well rounded and soulfully beautiful people that I know, because you have to be able to and be willing to face your demons head on, because that's the only way that it works. And especially if it is untreated mental health that's causing the substance use or whatever their addiction is. You know, you have to be willing to face that trauma. You have to be willing to face those demons that were sitting in the back of your head that you were trying to avoid. And that's why you got into substance use in the beginning, you know. But most people in society aren't willing to do that. You know, they're oftentimes not willing to face those battles. They'd rather just push them away and go focus on something else because they have that ability to. But people in recovery have to. And I tell my clients, life is always going to be hard. It is up to
Yep.
you where that hard is. Are you going to deal with the hard now to make it easier in the long run? Or are you going to push it away
Choose
and
your
avoid
heart.
it? Yep. Choose your hard. You have to
Yeah.
get
I
comfortable with
also like
being
to say
uncomfortable.
that's it. I say to people, you have better things to do with your life than avoid discomfort, because look where that's gotten you, right? And so in
Yep.
your demons, as you said, and facing the real hard stuff of life, man, it's uncomfortable. I don't know anything that gives you more maturity, more wisdom, more deepening, and more matter and substance than that. It's so worthwhile. And I guess for the last myth, I was just curious, with eating disorders, there's a lot of misunderstandings that they only affect certain groups like women, or only affect like high socioeconomic status, or only certain like racial group. Like, that's untrue. Eating disorders cut across every possible demographic that you can imagine. And I'm assuming the same is true with addiction, that every demographic can be affected by addiction.
You mean it's not just a bad childhood or trauma or poverty that makes it happen? Go ahead, Rowan, say more.
Not at all, because it is behavioral and because it is rooted in, you know, all those things that we've already kind of touched on. It doesn't matter who you are. It doesn't matter where you come from. It doesn't matter your background, your heritage, your ethnicity. It doesn't matter how much money you have. If you are going to be affected, you're going to
I
be
say,
affected. You
if you
know, the
have a
most
brain and
important
you have
part.
a body, you're at risk if you have a brain or a body. Right?
Yep. But, you know, what's ultimately important is being able to recognize that it's happening and get the help that you need so that you can shift those maladaptive behaviors and find coping skills that work and work through any trauma or things that are sitting in the back of your head so that you can have that productive life that you're meant to have, because every person is worth a good life. Every single person, no matter what their background is.
Yeah.
Rowan, that's just so hopeful. Like, I love the phrase hope springs eternal, and that it's never too late to turn your life around and make something really meaningful of your life. And I just want to thank you for what you're doing for people with addiction, and that you've been here to really clarify that addiction can touch anybody with a brain and a body, right? No matter your demographics, no matter what. Nobody is safe from addiction or an eating disorder, but everyone is open to the beauty and possibility of.
Good summary there. For those that may be wondering, what do I do if I have an eating disorder? What do I do if I have a substance use problem that I want to address? Do I have to do them at the same time? Do I do one at a time? The answer is actually depends. And talk to your team. Let's figure out which thing is more biologically, medically imperative to address. But ultimately, yes, it is a matter of addressing both at the same time because, as we mentioned earlier, the mechanics of these behaviors in your brain love to follow each other. So you take out one, the other one wants to show up. But I wonder too if you can go ahead, Rowan, and tell us a little bit about Transcendence Recovery here in Colorado and the services you guys offer.
Yeah, of course. Our office is located in Lakewood, but we go everywhere on the Front Range. So anywhere from Loveland to Colorado Springs, everywhere in between. We also have a sober living as well and a full clinical team. So we offer therapy, we offer IOP, skills classes, DUI classes. The idea is that it's all pathways, it's holistic. It's not about the substance. That treating the substance doesn't build a proper life, right? You treat the person, you figure out what they need, and what's going to benefit them the most. So is it budgeting? Cool, let's learn about budgeting. If it's just
Can I have
overall,
help?
sure. We're people centered. And I know that we often hear that a lot, but it really is. The first thing I talk to my clients about when I have an individual session with them is, what do you want? What is your goal?
Love it.
Not how can we treat this substance, or how can we build a coping skill toolbox for you, but what are you wanting to accomplish with where you are right now?
Thank you so much. We really appreciate you being here with us. This has been Doc Talk.
Thank you, Rowan, for joining us, and we'll see you next time.
You're welcome. Thank you for having me.